Okay, my name is Phil Rogers. I'm a 74-year-old retired vet. I retired about 10 years ago. I spent 41 years working in research on mineral metabolism. But I became interested in complementary medicine in the 70s, acupuncture, herbal medicine, homeopathy, and so on. And it's my very great pleasure today to introduce to you Dr. Hubert Karreman, who's an organic cattle vet from Philadelphia. He works with the Amish, and he has a very interesting paper on how he manages mastitis and infertility without the use of antibiotics. Hugh.
Good afternoon. It's an honor to be here, and I want to give you a glimpse of my life as a practitioner in the Lancaster County, Pennsylvania area, where Dr. Rogers said I've worked with the Amish for the last 20 years. I got my start in organic agriculture in 1988 on an organic farm. Saw the alternative treatments work so well that I wanted to go to veterinary school, and they actually accepted me. And I became a vet in 1995, and I've been mixing alternative and conventional medicines since then, pretty much integrative medicine. But about 2005, I made a firm commitment to only work with the organic farmers. And just to let you know, Lancaster County, Pennsylvania is the largest milk-producing county east of the Rocky Mountains in the United States. We have 1,900 dairy herds there. Pretty amazing amount of cows and farms. So with that little background, let me start up here. Okay. So this is the whole rub as far as working with organics in the United States. We can use any kind of natural treatment we like without any conditions, but we cannot use any synthetic medicines at all unless the medicine is rigorously reviewed by what's called the National Organic Standards Board, which I was on for 5 years, and then passed on to the USDA, and they make the final call. So that's a major issue, and that applies to land, that applies to animals, that applies to crops, that applies to processing, this rule right here. But I wanted to state that right up front. So in terms of livestock, this has been kind of the thorn in my side for, well, since I started in 1995 as a vet in the field. We cannot use any antibiotics or hormones for treatment with certified organic cattle in the United States. If they are treated with an antibiotic or a hormone, except for oxytocin, that is allowed in emergency use for postpartum emergency use, like after a prolapsed uterus is replaced. That's the only one that's allowed. But anytime like Lutalice or gonadorelin releasing hormone is used, or penicillin or ampicillin or anything, that animal must be removed permanently from the organic herd. It doesn't have to go to slaughter. It could go to a conventional farm. That's fine. That's much different than in the EU, which has a simple twice the legal requirement withholding time ×2, and the animal is back in the tank, putting milk in the tank, which to me seems really easy and a little too easy. Canada has a really neat rule that's halfway between the United States and the EU, where there's a 30-day milk withholding time. So that makes a farmer think long and hard about using an antibiotic prior to using it, and therefore they'll maybe use alternatives. But what I wanted to say up front, and it's in the paper in the proceedings, is I believe that the United States is probably leading the way globally in reducing antibiotic use and coming up with alternatives for treatments through the organic livestock sector. And I want to show you why. So I did want to also say that, a lot of times in the U.S. at least, a lot of people say, well, if you can't use any antibiotics, animal welfare is going to go right down the hill, and the animals are going to suffer. Antibiotics are only good against bacterial problems, okay? They're not for everything, and yet I think people reach for them all the time. Farmers, veterinarians, Veterinarians are trained in vet schools, and a lot of the therapeutics I learned and we learn are based on antibiotics and hormonal therapies, as well as other therapies, but that's the mainstay as far as treating infections. And of course, antibiotics aren't always indicated for like hot coliform mastitis or salmonellosis. You can have a carrier state develop with salmonella coliform. There was a study out of Ohio State that showed, I think it's just about a third of the animals with hot coliform mastitis are bacteremic. 2/3 are not, and so a lot of people say do not use any antibiotics on a hot coliform mastitis. But the problem with, as a clinician, is which cow is bacteremic, which isn't, and so usually you're going to use the antibiotic. Also, just because the organics can't use antibiotics, it doesn't mean that the conventional farmers jump to them right away. I think that's safe to say. You know, if an animal is lame, it might need an antibiotic for a foot rot, and there's a sale coming up in 2 or 3 days, that animal might not get the antibiotic. I think it is safe to say that if the antibiotic is indeed indicated and it is withheld, then animal welfare would be impacted. But animal welfare is a much larger, broader issue than antibiotics alone. So, prior to antibiotics, you know, we're all sitting here, our ancestors lived through infectious disease, otherwise we would not be sitting here. And it's all based on the immune system. That is what makes life keep going. And back before the antibiotic era, there were botanicals used, there were biologics used, there were mineral medicines used, there were lots of different kind of medicines used, lots. And yet we become so reliant on antibiotics, and this morning we had a great full room here for all 3 hours about reducing antibiotics, and it was wonderful. The talks were great and much needed. But I think we also need to offer some alternatives. And so this talk and the talks following me will hopefully do that. And patients did die from infections prior to antibiotics. They still do, even with antibiotics. Now, the U.S. organic industry does allow a few synthetics here. I personally petitioned the federal government to get flunixin, butorphanol, xylazine, and tolazoline allowed. They became allowed in 2007. After 5 years of being raked over the coals by the government to see if they'd be okay for organic use. They are, with twice the withholding time. And then some metabolic and antiseptic treatments are allowed as well. But the big thing is the no antibiotic rule in the U.S. So with that in mind, you know, how do organic farms stack up against conventional farms? So I did a study in 2006 with the Penn State Extension, and again, just a couple months ago with the University of Minnesota, Dr. Ricky Sorga, just real fresh data, doing matched pair controls between conventional organic farms. The 2006 study, I'll show you the data in a moment, were matched on breed, herd size, and being within 1 mile of each other, roughly 1.6 kilometers, I guess. And then the 2016 study, same thing, same breeds, same herd size, except within the same postal zip code. Just made it easier for getting the data. So in this study in 2006, there were 34 organic farms match paired with 34 conventional farms, and what's in red was to be shown significantly different. So the rolling herd average was absolutely big time different. And that probably back then was a lot of use of BST at that point, and also grain, a lot of grain use. The organic guys don't use a whole lot of grain. And then the second lactation showed a significant difference as well in favor of the conventional milk quality. And I don't know why that is, but an epidemiologist said at one other meeting that could be a stray finding. If it was repeated, it might not be the case. What's interesting, if you look at the, and this plays into the whole dry cow therapy, blanket dry cow therapy that was talked about a lot this morning. If you look at the somatic cell count at less than 40 days in milk, that'd be the fresh cows coming out of the gate, so to speak. There is no significant difference between the conventional farms and the organic farms. The organic farms cannot use antibiotics. These animals, if they're in this data, they have not seen an antibiotic at all since being certified organic. And it can be fairly assumed that the conventional are using dry cow antibiotics. 90% of the 9 million cows in the United States get dry cow treatment, antibiotic treatment. So and there you can see that there's no significant difference in milk quality. If we look ahead now 10 years later, just a few months ago, 2016, basically the same variables we were looking at, and there was a significant difference in somatic cell count score in favor of conventional with the linear somatic cell count score and the actual somatic cell count score, but you still can see that even at 269,000 pounds, and I'm not going to do the kilos, I'm sorry, but 269,000 pounds, not pounds, but somatic cell count was still well below the 400,000, which is pretty much the industry standard these days. Okay, that's still without any antibiotics being used. So this is from the 2006 study showing this is a simple linear regression, and I'm not a statistician or epidemiologist, so I apologize if I don't say the right word on that, but I believe it's a simple linear regression line, basically showing there's year 0 there at the bottom on the x-axis. Year 0 is there, and each of these diamonds, blue diamonds, are individual farms, and you can see from there's 16,000 to 17,000 pounds of milk, and then as you go this way, these farms are longer and longer certified organic. This one here is 16 years certified organic already. These are right at certification, we're 1 year into it. But you can see that the milk production does not decline precipitously. It's pretty level, even though they're feeding differently, they're managing their cows differently. Length of time certified organic for the actual somatic cell count. Once again, you can see these are individual farms, these red squares, and you can see between 300 and 400,000 somatic cell count. It stays about the same even with these farms that are very long certified organic, 9 years, 16 years. Okay, no antibiotics. We also had a 400 question survey with that study in 2006, and they were mainly yes-no questions for ease of statistics. And what we asked, do you wear gloves? We didn't ask what kind of gloves. We didn't ask on both hands. Maybe it's only one hand. We didn't, it was just, do you wear gloves? Yes, no. And, it showed that farms that wore gloves had better milk quality than those farms that did not by the somatic cell count score. Oops, I'm sorry. I just beamed somebody. And then we asked, do you use pre-dip? We didn't say what kind of pre-dip. We didn't say, do you dip? Do you spray? Is it iodine? Is it chlorhexidine? Just do you use pre-dip? Yes, no. And the farms that did had much better quality milk than those that did not. Okay? So that's from that study there, and the notation is there on the slide. So basically, conventional wisdom for milking hygiene applies to organics. Just because you go organic doesn't mean you can just throw caution to the wind. You need to still have clean udders, clean barns, good milking technique. Okay, especially since we can't use the antibiotics for acute mastitis or dry off, so you really got to be paying attention. So reproduction, let's look at that a little bit. You can have natural reproduction, or that's my wife Suzanne breeding a cow, and I wish she was here now, but we have a lot of cows calving in right now, so she's not, but here she is. Let's look at reproduction. In 2006, these are standard DHI numbers. In red is significantly different, and we can see that the average age at first calving on the 33 farms of the 34 that submitted data, conventional was better by 1 month. And I could get into a whole long talk about why, but I would probably say it was due to sometimes organic animals, when they're growing up, get heavily parasitized. So do conventional animals, but the conventional farms can use internal parasiticides a lot easier than the organic ones. So maybe there's a little bit of a growth lag that accounts for that. And then the cull rate was in favor of the organic herds at about 26% there versus 33%. That is, I think, the total. I'm not sure if that was the involuntary or voluntary cull rate. That study was 10 years ago, so I apologize, but that was the other significantly different value. So in 2016, just a couple months ago, this was done in February, there were 60 organic farms match paired with 60 conventional farms. And we can see that there's a few significant differences, all in favor of the organic. Percent observed heats, days to first service, days open are all less. And that's probably due to a lot of more natural cover and bulls being used in the organic herds. So the farmers aren't having to watch for heats as much. And days to first service, well, the bull is there. Okay, and days open, the bull is there. But what's interesting is that even given that, the pregnancy rate, which is a real key indicator for reproductive efficiency, is not significantly different. And the organic farms cannot use any GnRH or PG. And in the United States, I think on average, it takes about 4 to 5 injections through the synchronization programs to get cows bred these days, on average. I could be wrong, and I apologize if I am, but I think that's a number I've heard in the industry. And the organic farms are not using any. And the pregnancy rate is not significantly different. So that's some data just to compare. Our bovine vets interested in complementary and alternative veterinary medicine. You're all sitting here. You're all veterinarians of one shade or another, so I imagine you are. But this is a study I did back in 2010. I was recovering from open heart surgery for a bicuspid aortic valve that had to be fixed. I was bored. I wanted to do something. So I said, why don't I repeat the survey I did in 2005, which I sent through the mail. Now I could do online within the AABP listserv, American Association of Bovine Practitioners listserv. So perhaps some of you were in that study. There are about 185 replies over 2-week time, which was the same as the study before. It was maybe 1 or 2 replies different, but then I cut it on the electronic one in 2010. I said, okay, we're done. So first question, would you be interested in complementary and alternative veterinary medicine? Would you as a clinician or your farmers? Half of them said yes, 92 out of 185. Then I asked, would you be interested in CAVM products if they are presented from a rational pharmacologic basis? And that 92 that were interested initially in the open question went up to 147. So I know that my bovine colleagues, like right here, are interested if there's a scientific rationale for alternative treatments. Which diseases would you be interested in? These are standard ones: mastitis, calf diarrhea, metritis, infertility, pneumonia, digital dermatitis. All the above was 107 out of the 185. So there's interest in all the common conditions that cattle see. There's a lot of interest in alternatives. Do you work with any certified organic or transitioning to organic dairy herds? Half said yes, they are. Okay, if so, how many organic herds? Generally about 1 to 6 herds. Pardon me. Okay, some had more, like greater than 20. I was working with about 100 certified organic herds when I finished full-time practice in 2010. And last year I was working again with about 60 herds that are all organic. But it depends where the dairies are. You're going to find organic dairies where there's dairies. How many were milking in the herds on average? About 1 to 100 cows. And then in the U.S., we do have some large organic farms with greater than 1,000 cows out in the West. Okay? And do you feel that any of your conventional herds would be interested in complementary and alternative veterinary medicine? 46 said yes, maybe another 112. And then self-selecting question here, would you be interested in receiving information? And 141 said yes. So I know there's interest there if it's from a rational, logical basis. So with that data there, and you know, we can't use any antibiotics in the U.S. on organic cattle. And let me just say, I have nothing against antibiotics, not one thing. I just can't use them. So I had to come up with different methods and rely on older methods that were used prior to the antibiotic era. The biologics and the botanicals, they have rational basis. I know veterinarians are interested in them. Below that dashed line, you see acupuncture. That's fairly well accepted now. There's a lot of good information on that. Clinical cases, case series, as well as mechanisms of action. Homeopathy, I'll be honest, that's where I got my start in natural treatments as a herdsman. Okay, I'm not going to talk about it here, but it is one of the forms of treatment that a lot of organic farmers reach for. Okay, but it's not well accepted because there's not a lot of science behind it, but I think we're going to hear about some this afternoon. So the biological therapeutics, vaccines, well, they stimulate and or modulate the immune system, biologics. Okay, so they, obviously vaccines are the largest product sector in the biological therapeutics, but they're, biologics are made from viruses or bacteria or fungi or blood. Okay, and the vaccines, by the way, are all okay for organic if they're not genetically engineered. If they're genetically engineered or anything's genetically engineered, it's a big question mark, and at least in the U.S., it would be maybe wait a little while to see what your certifier says to use it. Okay? Therapeutic biologics give passive immunity. These were used in the old days. Diphtheria, they would hyperimmunize horses, they would draw the blood off, and they would separate it in such a way that they had the antibodies, and they would give it to humans, and it worked really well. Truly, it worked well. Also against measles sometimes, and then some of the old veterinary scourges that we still have: hemorrhagic septicemia, equine flu, hog cholera, white calf scours. And we still use hyperimmune plasma against rabies. If you get bit by a rabid dog and you're not vaccinated beforehand, you will get the biological product, rabies antibodies, as well as snake bite antitoxin. Oops. Okay. Here are just some biological products that we have in the U.S. There's serum products, there's plasmapheresis products that I just talked about. Colostrum whey products, I have a slide on that in a minute. They're injectables. They have a mild stimulation to the immune system. Bacterial cell wall derivatives are very interesting. This one from soil bacteria called ImmunoBoost is real nice for increasing the beta and gamma interferon. And then also eggs. They have IgY as their antibody class, and if you're going to use eggs, I mean, they do make a lot of products from eggs these days, IgY products, but a lot of farmers will put an egg in, I don't know, beer and give it to the calf or the cow, and it helps them eat or get better. If you're going to use eggs, try to use free-range eggs, so the chickens are scratching actually on the ground at the farm, getting the challenges of the farm to make antibodies against. Don't just use white store eggs that you buy from the big farms. Hopefully that makes some sense. So back in 1929, this was written up by a British veterinarian, A.S. Alexander, against strep ag mastitis. They could identify the strep ag mastitis, but they could not treat it too well. They didn't have antibiotics, I should say. And we know it's pretty sensitive to a lot of antibiotics, strep ag. But what they would do is they would take the cow's own milk, if it looked pretty good, they would take 20 cc's and re-inject it subcutaneously 5 times every other day, so over 10 days. And if there was not an immune reaction right at the site of the injection, the cow tended to cure, and they could prove that by looking at the bacteriology, which they knew about at that point and could identify under the microscope. The colostrum whey products that I mentioned in the last slide, such as this particular one here in the U.S., are basically kind of a really refined modern way of doing a very crude method that they used to do in Britain in the late 1920s. And so, some farmers are interested in trying to do that. And you can also make autogenous vaccines for pink eye. I do it for Staph aureus mastitis. They're made by pharmaceutical companies that make vaccines. They're USDA licensed facilities. And they work pretty well if you use the Staph aureus vaccine starting at like 6 months of age and then at a year, and again right before they freshen every year. So plants as medicine. I got plants as food, we got plants as medicine, and also self-medicating animals here. This Holstein is eating from a willow tree, which of course is the basis of aspirin way back when. Salix, S-A-L-I-X. You want me to answer that? They have a question. Yeah, and zoopharmacognosy is a really interesting field that's coming up. Mostly animals will self-medicate, at least monkeys and wild animals, in high tannin-containing plants against internal parasites at certain times of the year. So, here's some antique bottles I found at an old store once, and I love showing the slide because, here's the old Latin names, uva ursi for bearberry, triticum squill, convallaria, which would be lily of the valley in English. But what's more interesting is you look at the company names here. You got Wyeth, John Wyeth, you got Eli Lilly, you got Park Davis, and you got Sharp and Dome, which is Merck Sharp and Dome, which I think is MSD now, right? And they're here today. So they got their start with plant medicine because the pharmacology in them has action, okay? And organic chemistry, once they could identify the active ingredients in these products, they quickly started to synthesize them so they would not be waiting on literally boatloads of plants of questionable material or identification coming in from exotic areas of the world. They could have total control on the production process, and so then the modern pharmaceutical industry started. But they all started with plants. And Bayer, who's here, started with aspirin way long ago in the late 1800s. Here's a short list and an abbreviated list of dosages for horse and cattle, sheep and swine from Dr. Pierre Fish, who was the dean of the Cornell Veterinary School. And he came out with a small pharmacology book in 1930, basically showing all these tinctures with a T or the O as an oil, or the FE as a fluid extract. These are standard medicines for veterinary medicine way back when. And these are just some dosages, and I use some of these still now. But, that's what we used long ago. And so like old pharmacology and toxicology might be displaced by really excellent research and developments, but it's still factual. It's just kind of got a layer of dust over it, a layer of time. Here's some modern research with botanicals, just to bring it up to speed. And this is on a product called Phytomass, which is a botanical formula, which I admit I formulated, okay? But these are all studies from the Journal of Dairy Science, okay? As someone said this morning, the reflection of the dairy industry. Mainly done at North Carolina State University by Dr. Keena Mullen and Dr. Washburn, Dr. Anderson, Dr. Ron Baines, and Dr. Baines and Dr. Anderson are here in the audience today, which I'm very honored that you're here. This here, I'm not sure about actually the years, but it's in the last 2, 3, 4 years all this has come out, okay? But basically, in that product, essential oil of thyme is the key ingredient, and it's nested within some other oils within olive oil as the carrier. But what they found, at least in vitro, was that thyme oil at 2% or more killed the bacteria that they were looking for, the Staph aureus, the Staph chromogenes, and the Strep uberis. Totally killed it, whereas the other ingredients that are in there had variable effects. But that's in vitro, and anything can look good in vitro. I think we all know that. Here's a study, clinical study with a large dairy herd out in Colorado, by a fellow Dr. Pinedo from University of Florida, who I think is at Texas A&M somewhere now. And what they did, they took over, I think, 9, 10, 11, 12 months, 100 cows that had mastitis. Every other cow that had mastitis they would treat with that Phytomass, and the other ones they would not. So they were acting as controls against each other. I'm not an epidemiologist, but anyway, that's what they were doing. Every other cow got treated. The other ones just didn't, like they had been doing all along, no treatment. And what they found in this study was that there was a reduced amount of time to the clinical recovery using the treatment versus not. And most organic farms just won't treat. Maybe they'll strip out the cows more often, but there's an alternative there. So it resulted in a reduction of time to clinical recovery. This study here took the Phytomass and another product called Cinnatube, which has, I think, honey in it and cinnamon, essential oil of cinnamon, and it acts kind of like a plug. That's how it's marketed, as a plug. And with the Phytomass, and what they found comparing it to antibiotics plus the Orbicil was that the efficacy of the herbal products had roughly the same effect, I think, at curing and preventing infection. So you can look that up. These are all in the journal Dairy Science. One study that's not in any journal, because it was kind of a lopsided population from what I understand, and there wasn't enough animals to have it be spread out enough, or whatever the epidemiologic term is that they used Phytomass and Orbicil. So Orbicil cannot be used in the U.S. with organic dairy cattle. It's not allowed, but it can be in Canada. It can be in Europe. And what they found was that the Orbicil plus the Phytomass gave just about the same result cure as the literature stated cures with, is it Spectramass? No. Quartermaster and Orbicil. Dihydrostreptomycin antibiotic plus Orbicil. Gave just about the same as the literature published results there. So, you know, if you're looking to perhaps reduce blanket treatment with antibiotics, there's something that possibly would do that. Probably most importantly, because as veterinarians we all know the efficacy of products is highly dependent on clinical background, clinical case, but more important to food-producing veterinarians is residues and making sure that the food supply is clean. And so about 5-6 years ago by now, a third-year veterinary student, Claire McPhee, did a study. That's her infusing some of the Phytomass into goats. And what they found, if I recall correctly, is that they had the goats catheterized. They were taking blood every 2 hours, taking milk samples every 12 hours, and they could not find the essential oil of thyme, which was their marker they were looking for, in the bloodstream after 4 hours. It clears very quickly, and they could only find it in the milk up to 12 hours. So it clears very quickly. It's a natural product, and so that was. I'm not sure if that was written up anywhere besides as a poster at one of their talks, but it was done through the Food Animal Residue Avoidance Database, which is stationed at North Carolina State, which is the big go-to for information for veterinarians wondering about what the withholding times are for various treatments. And right now, Dr. Mullen, who's still at North Carolina State, and she's the first person in the U.S. to get a PhD in the non-antibiotic treatment of mastitis, got a $1.3 million grant that she's in the middle of working with to follow up on this study, which is with goats, but with cows, dairy cows. And so that's going to give some really nice information for the dairy industry rather than extrapolating from goats. Pardon me. What's that, year 2 I think they're in right now? Yeah, out of a 3-year study. Uterine infections. We looked at some reproductive data. What do we do if we can't use oxytetracycline in the uterus or whatever for the organic cows? Basically, good old-fashioned iodine, great antiseptic. Some people would say that iodine burns the uterine walls if it's used willy-nilly too much or not correctly. But for me, as a practitioner, when a farmer has a puerperal metritis or a septic metritis going on, you reach in that uterus and it's just a big watery stinking mess and she's sick. You got to fight fire with fire, and iodine put in the uterus every day until that cervix closes is very beneficial, and I usually use 1 gram or 4 of those tablets you see there every day. And the farmer can do it themselves, of course. And then after the cervix closes down, then you would be infusing either an iodine solution or mixing it with dextrose. The reason I mix iodine with dextrose these days is a nice study that was done out of Ohio State, in 2010, it looks like here, and written up in the AABP proceedings. That group looked at a large farm in Ohio, conventional farm. They could use antibiotics if they wanted, or Ludolice. And at 20 or 18 to 21 days fresh, they had three groups. One was treated with antibiotic, oxytetracycline, in the uterus. The other one was treated with PG, prostaglandin, F2 alpha. And the third one was treated with straight dextrose. And what they found is the oxytetracycline treated uteri were the best treated. They came back the fastest and were cleared of infection, whereas the PG and the dextrose infused ones were equivalent. So when I see that dextrose gave equivalent results to an injection of PG and I cannot use PG, I'm going to start thinking about using dextrose. And so that I do, and it works really, really well. Good old-fashioned 50% dextrose that you would give for ketosis in a cow, infused into the uterus. And thank you, great. And what I do for a pyometra, because pyometras definitely are conditions where cows in organic herds can leave, especially if they're long-standing, and the pyometra is like about as big as a 4 to 5 month pregnancy, but it's pyometra. There's like no treatment for them. But if you can get them early, if you're palpating the cows every month, you go in there and you feel, a pyometra that's the size of a 60 or 90-day pregnancy, so to speak, and you infuse dextrose, about 1 part of dextrose, 3 parts of dextrose, 1 part of iodine. 3 parts dextrose, 1 part of iodine. That's in the proceedings. All this is in the proceedings. And you do it once a week for about 3 weeks. They clear generally more often than not. Okay, but you have to reach in to palpate to see what the size of the uterus is so you don't put in too much of that solution. Because in my excited, realization I could use this, I had some larger pyometras that I put in like 300 cc's of dextrose and iodine, and they got a perimetritis after that, and they were out the door quicker than they would have been otherwise. So you have to palpate the uterus to see how big it is and kind of just almost have an intuitive feel about how much volume of this dextrose iodine you should place in there. I don't know if that makes any sense, but I guess clinicians have those intuitive feelings at times, and it's okay. For cows that don't have heats, I use a combination. The trade name is Heat Seek. It's a phytoestrogenic botanical mix. I can't use PG to get the heat when they have a CL. I can't inject that with the organic cows, and you saw the pregnancy rates are all the same. So these treatments you're seeing are part of what makes that data that you saw earlier. But the botanical mix is there in italics, and if you couldn't get anything except for the the Dioscorea villosa. If you only had to get one, I would get that. But the Angelica sinensis is also very important. And this product will bring cows in heat very visibly. Cows that are beyond peak milk lactation, that have a normal body condition, that are normally cycling, you palpate them every month or 2 weeks, and they have a CL and a follicle and it's switching over back and forth, and they're not showing heats. This botanical combination, and that's the generic mix right there, will bring them into heat like amazingly well. I mean, I would guess about 80% of the time, to be dead honest, maybe more. You want to start it when you would give that injection of PG instead of the PG, the prostaglandin. You would start it at mid-cycle towards the estrogenic phase of the cycle when the follicle is maturing. Okay? So that's when you would start that. If there's a cyst on a cow, I'll either try to rupture it or I'll use some homeopathics that are actually very, very effective on cystic fluid buildups, Apis mellifica, Vespis, the lachesis, and the gnat-mure. Or I use acupuncture. And I'm not sure if anyone's going to be speaking about acupuncture today, but here's an expert sitting right next to me, absolute expert. I'll use injections of vitamin B12 along the acupuncture points that are along the short ribs, just lateral to either side of lateral to the side of the backbone on the side of the cyst. and I inject 5 cc's of vitamin B12 in each of those spots. Or I go with that phytoestrogenic mix for 12 doses or 12 days in a row. Last 2 slides I want to leave you with, because not everything is mastitis and infertility, but actually my love is working on individual cows. That's why I went to veterinary school. That's what I love to do, is individual cow medicine. I love it. I can't use antibiotics. I don't have anything against them, as I said. I throw the kitchen sink at the cow IV when I treat her, okay? So I use the biologics. I'll use the antibodies. They're commercially available. I'll use the immune stimulant as a biologic from the soil bacteria. Great. And I'll use sodium iodide, 20%. That's an old-fashioned anti-infective, antibacterial. And then there's a botanical mix that I use from a manufacturer that has garlic and barberry and ginseng, wild indigo. Basically, it has the sulfoxides in it. It's got berberines in it. It's got hydrastine in it. They're all really strong antibacterials. And I mix that in a bottle of dextrose, that botanical mix, and I give it IV. And you wonder, why would you do that? It's not made in a sterile form. No, it's not. But when I read that the Chinese in their hospitals give tea infusions IV, I thought, well, you know, it's cows. I can do that with cows. So I do. And it's great. And they're breathing the garlic right away. You know, they're circulating right through them. So that's the botanical side. The biological side, I've already run in the IV. Okay, then I add in a bottle or 2 of vitamin C IV as an antioxidant. And if it's an old Holstein or Jersey cow, I'll give it some calcium. If they're really dehydrated, I give it lactated ringer solution or hypertonic saline. And that's how I treat a cow. So here's a sick cow, and that's basically what I've done a lot, because the farmers treat their own mastitis and uterine infections. So this is last slide. Sandy, this cow that was due in 3 days, dry cow, due in 3 days. Farmer called me, said, hey, I got a cow due in 3 days. She's got a high fever, 105 Fahrenheit. I don't know what it is, 41 centigrade, I'll just say. 42, how's that? That's even worse. And watery quarter, hot, hard, watery quarter. So it's presumptive coliform mastitis, and she's breathing hard. And I'm like, oh, man. And she's 3 days away from calving her due date. That's a sick cow. So he knew how to give the IVs that I just mentioned. He gave the biologics. He gave the botanicals. He gave the vitamin C. He also gave her some oral Calophilum thalictroides, which is blue cohosh, which has some action on the myometrium in research to maybe start the uterine contractions. He called the next day. He said, well, she's holding, but she's not getting better. Can you examine her? So I came out, and I had just had 2 or 3 cases of first calf heifers that were overdue and had a lot of udder edema. And I used electroacupuncture on them in certain points, and they calved within 12 hours. I couldn't believe it. That was after I reached in. The cervix was still closed. They calved within 12 hours. So I tried it on this cow to get her to calve, because she still has to go through that even though she was sick. And did that, and I gave her some IV calcium. She was going into like 4th lactation, and her ears were a little cool. So I thought she would have calved. I stopped by the farm. There was no calf. That was a Friday, going into the weekend. And the farmer called, said, should I send her down to the vet school half an hour away for a C-section? I thought, she's not a good candidate for a C-section. She's holding, but I know they're going to use antibiotics at the vet school. That's a given. And, you know, she's holding. Let's see what we can do. I said, our ear tips, how do they feel? They're a little cool. I said, give her some IV calcium. Call me in the morning. Like, take 2 aspirin, call me in the morning. Give her some IV calcium, call me in the morning. He didn't call. I got curious. I went out to the farm Saturday afternoon, and he told me that he delivered the calf at 2 in the morning. She had good colostrum in all 4 quarters. She passed her placenta. So she had a hard start. That's her there standing there about a month later. Difficult start, but, you know, if we hadn't done anything, she would have been dead. We did these alternative treatments, and she was a productive cow again. So systemically, it's an interesting way to treat cows as well when you cannot use any antibiotics. This is actually the last slide. Sorry, I still have 1 minute. So in Pennsylvania, just recently, a few weeks ago, a 48-year-old woman was diagnosed with a urinary tract infection that was completely resistant to all antibiotics. All the alarm bells went off in the medical community. I mean, it's a serious problem, antibiotic resistance. And all I can say is that, you know, from having worked without antibiotics 20 years now, treating cows in lots of ways, and there's data here to show, you know, that organic cows rival or pretty not significantly different than conventional cows. These are some of the treatments that have fed into that data you saw. Maybe the U.S. organic livestock sector should be looked at as a possible source of solution. So thank you for being here today, and I'd take any questions, or am I really out of time? I think I am.
We have time for one question. I am absolutely going to stop this when the alarm goes. So if you don't get the question answered, ask Hugh afterwards. Thank you very much, Hugh.